Every 20,000, the ertified fiatational clarity, discovered and his Hanluving. Every 40 seconds, someone in America has a stroke, and the single biggest factor in whether they walk out of the hospital is how fast the people around them react. A stroke can look like a person struggling to smile, one arm quietly giving out, or words that suddenly stop making sense. And most people miss it because it doesn't look like an emergency. In the next few minutes, the 4-second test that can catch a stroke in under 30 seconds, why the first hour after symptoms start is called the golden hour, and the one common home remedy that can make things dramatically worse. This is first hour, and today, stroke, the fast test, and the golden hour. A stroke happens one of two ways. Something blocks blood flow to part of the brain, or a blood vessel in the brain ruptures and bleeds. The blocked kind is called an ischemic stroke, and it's behind about 87 out of every 100 strokes. The bleeding kind is called a hemorrhagic stroke, and while it's less common, it's more often deadly. Either way, brain cells depend on a constant supply of blood, and once that supply is cut off, they start dying almost immediately. On average, a stroke kills about 1.9 million brain cells every single minute it goes untreated, which is why speed isn't a detail here, it's the entire treatment. Doctors and the American Stroke Association teach a simple test to catch this fast, and it spells a word on purpose: fast. F is for face. Ask the person to smile. Does one side of the face droop or feel numb? A is for arms. Ask them to raise both arms. Does one arm drift downward, like it can't hold itself up? S is for speech. Ask them to repeat a simple sentence. Is it slurred, strange, or hard to understand? Some hospitals now teach an expanded version, B fast, adding B for a sudden loss of balance and E for sudden vision changes in one or both eyes. T stands for time, and here's the fix. The moment you notice any of these signs, call 911 immediately. Don't wait to see if it passes. I arively begript in fewer critifis progeting. Note the exact time the symptoms started, or the last time the person was seen acting normal. That single detail can change what treatments are even possible later. Do not give the person anything to eat or drink, even water, because a stroke can quietly impair the ability to swallow safely. Do not give aspirin, even though it helps during a heart attack. In a stroke, if the cause is bleeding instead of a clot, aspirin can make that bleeding worse. Keep the person calm, lying down with their head slightly elevated if possible, and stay with them until help arrives. Any fast sign, even one, even mild, even if it fades away in a few minutes, means call 911, not urgent care, not wait and see. Here's the line on symptoms that go away. If signs appear and then vanish, that can be a transient ischemic attack, sometimes called a mini-stroke, and it is not the all-clear it feels like. About 1 in 3 people who have one of these mini-strokes goes on to have a full stroke, often within days, so it gets treated as a true emergency too. Here's the line on headaches. A sudden, severe headache, unlike any before, especially with no clear cause, can signal bleeding in the brain and needs 911 right away. Once 911 is called, get ready to answer questions fast. When symptoms started, any medications, any recent falls or head injuries, At the hospital, a CT scan is usually the very first step because it's the fastest way to tell an ischemic stroke from a hemorrhagic one, and treatment depends entirely on which type it is. For an ischemic stroke, a clot-busting medication can be given, but the strongest evidence is within 3 hours of symptoms starting, with a narrower extended window up to 4.5 hours for some patients. That's the golden hour in action. The earlier that medication goes in, the better the odds of walking out with little to no lasting damage. For certain large clots, doctors can also thread a tiny device through the blood vessels to physically remove it, a procedure that can help selected patients even up to 24 hours later. Myth: give the person an aspirin right away, just like a heart attack. False, and potentially dangerous because a stroke caused by bleeding can be made worse by it. Myth: if the symptoms go away, it wasn't a real stroke. False. That's often a mini-stroke, and it's one of the strongest warning signs in all of medicine. Myth: strokes only happen to elderly people. False. Strokes can happen at any age, including in children and young adults, though risk does rise with age. Myth: there's nothing you can do to prevent a stroke. False. Up to 80 out of 100 strokes are considered preventable by managing known risk factors. Myth: a stroke always causes obvious paralysis right away. False. Especially in women, a stroke can show up as sudden confusion, extreme fatigue, or a severe headache with no weakness at all at first. High blood pressure is the single biggest driver of stroke risk. Around 75 out of 100 people who have a stroke also have high blood pressure. Smoking roughly doubles stroke risk because nicotine raises blood pressure and carbon monoxide reduces how much oxygen your blood can actually carry. Diabetes, high cholesterol, and being overweight also raise the risk significantly, especially when they show up together. Atrial fibrillation, an irregular heartbeat, lets blood pool and clot inside the heart, and those clots can travel straight to the brain. And as we said, women often experience atypical warning signs like sudden confusion, extreme fatigue, or nausea, which is exactly why the FAST test matters for everyone, not just the classic picture. Quick recap: face drooping, arm weakness, speech difficulty, time to call 911. If it fades, it still counts. If it's a severe new headache, it still counts. Prevention comes down to the boring basics that actually work. Manage blood pressure, don't smoke, control diabetes and cholesterol, and get moving most days. We built a free, printable stroke-fast checklist, the test, the timeline, and the myths, all on one page at firsthour.com. Link is in the description. If this helps you catch a stroke 1 second faster, subscribe to First Hour for weekly emergency preparedness videos and share it with everyone who has aging parents or just a pulse. Stay ready, stay calm, save a life.